Not much in here,
Nothing, yeah.
but I want to hear what's going on with you and what brings you in and makes you make the appointment.
To get this pain on my right shoulder, doc, due to like weight, weightlifting. I'm in free weights, and then just like 2 years ago, I lost our daughter.
Oh, I'm sorry to hear that.
This month.
Wow.
Due to suicide. She's like
Wow.
22-year-old, so just
my
like
goodness.
a stress probably, and then feel like a line of something that would when I stretch down like this, it would like kind of run through my right upper shoulder, going down to the lower back here. Don't think too much about it, but maybe like some stress, and just like also experience what they experienced during those YouTube videos. So yeah.
So I think that there is a lot that's so I want you to, we're gonna have to scale it back a little bit. All right. I think that there's probably a lot of stress in your body, and you try to set, like you just said, you try not to think too much about it. So when you try not to think too much about it, doesn't mean that it's not there. And when it's not there, and I mean, you've had some significant loss, and when you have significant loss like that, your body will hold a lot of that stress. Okay. So one of the biggest things that I tell people is that we have to be vulnerable with what's going on with you right now, because not only is it the physical stress that's probably keeping this where it's at, but it's the emotional stress as well too. And what a lot of people don't realize is that your body, your physical form, your nature will distort. It will be in pain for three things: traumas, toxins, and thoughts. So you could have no injury and have terrible thoughts and have a physical problem. Does that make sense?
Yeah.
So when I'm thinking about like what you've been going through, I mean, I can't imagine to be in your position. You know, I just had a kid here 7 months ago, and loss has got to be incredible. So my heart goes out to you, man.
Thank you.
And I think a lot of it, you know, how long ago did this start?
Just about probably around the time too.
Around the same time, right? So everything's probably happening around the same time into there. So I think a part of what's holding this is not only just physical, but it's the emotional part as well too. If I could just, can I be completely honest with you? I think what's going to benefit you here in the long run is not just you getting one adjustment and being gone. I think what will value and give you the most value is if you continue to get adjusted. And the reason why I say that is because your nervous system right now is processing everything. It's been what, a year you said?
2 years.
2 years. 2 years. That's still a very short time.
Yeah.
Right? I have patients in here that have suffered the same thing, and it just kind of reoccurs. Like there are certain spots in some of these areas where you get super stressed for a certain reason. And when that happens, right, same areas kind of flare up. And until you get to this level of point where your body is able to positively overcome more than it is negatively impacting it, that's when it truly just kind of goes away. We're going to do everything physically that we can do with you, but I want you to think about the long-term effect of what it could happen to you, all right? Because even though it's a big emotional thing, the physical thing also has to be released too. I truly believe like what happened and what's going on here, they're going hand in hand with each other, 100%.
I believe so.
Yeah. And the other thing is that, you know, the way that your structure is as well too, I think contributed to why this is happening. So it's a little bit of both, right? You already had something that was happening in your spine. It may have not been anything that you ever thought. It may have just gotten stiff, and you're like, whatever. And then something else happens, something traumatic, and then all of it just becomes worse, right? So what we want to focus on is not just the physical part of it. We want to focus on the emotional part of it too. So I don't know what it's like to get over a loss of a child. I have no idea. And I hope, you know, you can find some comfort at some point in your life with it. But we want to be here not just for physically, but we want to be here for you emotionally too. This is a space that we create so that you can have enough time to do what you need to do. If you cry during this visit, it's okay. Okay? If you have an emotional response during this visit, it's okay. You're allowed to be vulnerable. You're allowed to be open during this visit. And I know it's something that's hard to do as Filipino men, right? As people that as men just in general, because we have to be strong for, I mean, I can't imagine how strong you've had to be for your wife.
Yeah.
You've had to,
To children.
to the children, yeah. You've had to be the strongest person, right?
Yes.
You have to. But we have to take care of you, okay? So that's why we're here.
Thank you.
We want to take care of you.
Thank you.
All right. What I want to show you here, though, is some things in your spine that we are going to address during this time. And I think as we start to address it, your body's going to be able to take it. So a part of you, like, we don't want to battle the mental and the physical stress at the same time. As we start to release what's going on in through here too, then hopefully your mental part can also release a little bit well, right? It's just such a crazy interaction. And your mental and your physical do this dance all the time. And so we want to bring it back to its optimal level and keep you at this optimal level, okay? So what I want to show you is a couple of things. So your shoulder, let me just back up. So your shoulder, any headaches, neck pain?
Not really, just like
Just the right side of your neck?
Like there's like sometimes like I hate running.
Yeah, all the way down to your lower
Yeah,
back
when
too?
I try to like crack it like through stretching,
Yeah,
it would kind of respond, but it's still there. You can
Yeah.
feel.
anything in your lower back?
Not too much
Okay,
with my
but you
lower
have
back.
something there?
Mm-hmm.
Where at?
Like more in the mid back here.
Okay. So I'll tell you, so it's a funny thing that a lot of men will always have lower back pain. A lot of women will always have more like neck pain, shoulder pain, headaches, stuff like that. So it's always a little bit odd to me when someone has something going here and they're a guy. The reason why is just the way that your body takes it. We're so used to being like the providers and whatnot that we take a lot of this stress. And so when you start to take this stress here, it becomes more of the emotional, so more of the feminine stuff, more stuff like that, where it impacts your life in kind of a different way. And I'm sure these emotions that you've had to deal with are so new, and you've had to take in so many different things and try and process them, and your body is like, I don't know what this is. So we want to definitely open this. We're going to treat your entire body so that you continue to feel better. Okay. Now, when we look at this, I'm going to show you what your X-rays look like here. So. From you to me, obviously this should be straight up and down, yeah? Mm-hmm. From the side, there should be different curvatures. So there should be a curvature here, curvature here, curvature here. In your neck, there should be a curvature that measures around 43 degrees. Lower back, there should be a measure that around 40 degrees. That's what we want to see, okay? Mm-hmm. So when I bring up your X-rays, I'll show you something. So this is your lower back here. And ideally, when we look at this like this, so it should look I'll bring this down. Okay. So do you notice how this here is straight up and down? Yes. And it's level? Mm-hmm. And then when we look at yours, you can see that it's a little curved, and then this is a little bit further down that way. So we need to push upwards to help your body up. Okay?
Yes.
The next thing that we see is that when we look at this mid back, and I think this is a big reason why you're having a lot of the back issues. So on the right here, you see how straight it is? Okay. And then when we look at yours, is that straight?
No.
No. You're curving really hard off to that left side. It goes all the way back to that right side, like this. And then we look at your neck here, and it's like shifted all the way to that right side. And that's why I think you have a lot of this right-sided issues, because everything's just pushing out that way, okay? And so we need to fix this, bring it back alignment in that position, and get your body to feel better. The other thing is this. So this is a side view of your neck, and this is what it looks like it should look like. And so we talk about the curves, right? So when you see this curve here, what do you notice about your curve compared to the normal?
Moving forward.
You're moving forward a lot, right? So what's happening with you, the reason why this side is hurting, is because you're forward like this, and you're translated to the right, and you're like this. And so if I'm like this the whole time, and I walk around like this, do you think I'm gonna hurt? Yeah.
Yeah.
And that's what's happening with you, is you're like this the whole time right now. So what you want to do is restore that balance, get your body to shift back this way so that your body can be straighter again. Much more balanced, much more aligned. The most important thing here is not even just your spine, it's your nervous system. The nervous system that's going through that spinal cord, or through the spinal canal, I should say. Those are the nerves from your brain all the way down to your spinal cord. That's where all the nerves come from. When it is being shifted and pressured in weird ways, it's going to cause a dysfunction. And right now, this is causing a huge dysfunction because of how you are turned in a weird way. Okay, so what we want to do is pull, straighten, tug your body out. All right?
Yes.
Any questions for me?
Does it affect your emotions now?
Absolutely. Yeah. Well, what kind of things are you feeling now?
It's just like more of not really anxiety. It's just like just hard to, when I work, kind of getting more stress.
Mm-hmm.
But just in general, like also when it's just like more work related stress.
Do you feel like
also.
it's hard for you to turn it off, like to relax?
I could be relaxed if I'm home.
Okay, but at work it's kind of tough.
Yeah.
Okay, could be. I mean, especially like you're dealing with this and it just.
Because I walk most of the time, like 90%.
What do you do for work?
I'm a nurse.
Okay.
Acute, urgent care.
Mm-hmm. Yeah.
We walk all the time.
Yeah, you're walking all the time and you're stressed out all the time.
Yeah.
Yeah. So absolutely.
Makes sense. Thank you.
Yeah. So what I want to do here with you is we're going to adjust you, and what we need to do is get these curves to restore back, and I need to push this up to the opposite way. So we need to restore curvatures. The way that we do that are three things. One are the adjustments. Two are stretches and different exercises. And three, we have traction blocks. Traction blocks, all you have to do with this is lay on the floor at the end of the day after you're done. Allow your body to expand, open this area up, the neck up, so you get that curve back, and allow you to take that weight. Because when you think about it, when you're walking throughout the entire day, gravity's it's just compressing you, right? So when it's compressing you all the time, and you have a weird shaped spinal cord, do you think that that spine can take the weight well? No. So right now, it just can't do it. So we need to change that to help your body out. Okay?
Yeah.
Sound good?
Yes.
All right. Right now, we'll see how your body does after today, but I'm gonna recommend maybe once a month to twice a month, right? I just wanna see how your body responds, and based on how your body responds, we'll do that. We normally do about 6 months so that we can see how your body responds afterwards, all right? But I wanna get you out of this trauma care, this pain care, into a wellness care, right?
Yes.
I'm a product of it myself. I used to have severe lower back pain, and honestly, the biggest thing that's kept me out of it, and it's been 16 years since I've had pain, but the reason why it's attributed high percentage is because of chiropractic. So that's the value. There's a real value in it. You ready?
Okay. Yes.
All right. Scoot back a little bit towards me here. All right. And let's do this. Let's have you turn. And so what I'm actually just noticing before we get to that, I'm noticing his head is going down like this. And I'm just being very exaggerated by it. It's going down like this. And then all this is going down to that left side. It turns and rotates inwards. And then because it's turning and rotates inwards, this is moving up and this is moving down. So you have this like band that comes up. It's like turns and then comes in and then comes down like this. Ken, come this way. So I'll show you from the back right here. So you can see how his right occiput's higher. It comes down. This one's lower, opens. This is a lot higher than this one. Above. You can see this thing wrapped down under, and that's why this one is shorter, because this is wrapped forward that way, okay? So let's look straight. Turn your head to the right for me. Okay. Look straight again, don't force it. Stop before you have to force it, okay? Okay, look to the right. Okay, so right about there. So nose is about 70 degrees, not terrible. We want you to be closer to 90, this way without having to force it. Look to the left. That's tougher, yeah? Okay. So nose is about 45, maybe not even, and we need to be closer to 90 here. So when you look to the left, where do you feel the pain?
Here.
Can you point to it?
Would be here.
In that lower spot right there, yeah? Okay. Look straight. gonna feel in through here. Atlas. That is posterior like a mobile. Okay, let's have you, Ken, go to the side. Let's have you look all the way up to the ceiling for me. Is there any pain when you do that?
No.
All right, and then look all the way down. Is there any pain when you do that?
No.
Okay, look straight. Stand up for me as well too. And move forward. And try and touch your toes. Oh, too much, watch out. Come back. Okay, stay right there. Now try and touch your toes. Okay. Any pain when you do that?
Yeah.
Where at? Right there? Okay. Come back up. Okay. Let's have you go face down into the table now for me too. And scoot down towards your feet. That's it right there. Just like this. Relax there more. Good. So I want you to relax the shoulder. That's good. Scoot down a little bit more for me. That's it. Okay. So from here, I want you to keep the left leg straight and lift it up as high as you can go. Okay. Go back down. Any pain when you do that?
A little bit.
Right there? Okay. Do the right side. That one's easier, yeah?
Yeah.
Okay.
That's it.
Still there. Okay, got it. All right. All right. So I'm going to feel through some areas here, okay?
Okay.
Okay. I want you to take a deep breath in and push the stomach upwards, okay? So deep breath in right here. Yes, exhale all the way out. Beautiful. Again, deep breath in. Let the air all the way out. Good, more. Deep breath in. That's it, exhale all the way out. That's better. I'm gonna help you up, deep breath in, more. Yeah, exhale all the way out. There we go. And then right in here, deep breath in. Let all the way out. Good. Slower, deep breath in. More. Better. Exhale all the way out. That's it. And deep breath in right here. Exhale all the way out. Open this chest up, all the air in your chest. Deep breath in, more chest air. Exhale out. I'm gonna guide you, okay? Deep breath in here, more. Chest up, more. Exhale out. Good. And then right in through here, all chest. Deep breath in. Yes, exhale out. I want another one of those. Deep breath in again. That's better. Exhale all the way out. Good. Now lift the left leg up, all the way up again. Good. How did that feel this time?
Still tight a little
Okay.
bit.
Go back down, do the right side. Okay. Feel a little easier this time?
Yeah.
Good. Okay. I want you to lay on your back for me first. All right. Keep this right here instead. So what we're gonna do here is we're gonna open up his occiput. This left side is so compressed and it's going down into his shoulder right here. So I need to open this area up in order to do this. So we're gonna do a vertical crane move. Pretty crazy, but awesome. You ready?
Yes.
All right. Yeah. Lips and teeth together for me. That's great. That's great. I'm gonna put this down a little bit more. Okay. That's it right there. Okay. Deep breath in through your nose, out through your nose. Yeah, it's doing better. Deep breath in through your nose, out through your nose. That's it, yep. There it is right there. Deep breath in through your nose, out through your nose. Good. Again. Exhale out of your nose. Good. Still releasing a little bit more. And out. Wow.
That's good.
Could take a minute.
Yeah.
Yeah.
It's good. Thank you, Doc.
You're welcome. So we're gonna let his body just kind of process that. We can see it just kind of trickling down and opening up a lot more. What are you feeling?
I feel like I was like my neck turned to this side. Like feels good.
A little less tension, huh?
Yeah, much lighter now. I could feel the difference. Yeah, because there's there's like a band here that you would feel it. It's just there. Yeah. Thank you.
You're welcome. A lot of relief, huh?
Thank you.
You okay?
Oh yeah. Thank you, Doc.
You're welcome. It's also a reason why I don't rush it, because not only does the physical stuff allow your body to relax, even like your face is turning a lot redder, which is awesome. But I'm sure you can attest to this, but there's also like a little bit of an emotional thing that's happening with your body right now.
Yeah.
Yeah.
Feels lighter.
Like you're not having to carry as much stress a little bit, right? Yeah.
Yeah, something. Yeah, I just can't like explain.
Yeah.
Like the most common thing that they'd say is like something like the lift is not there anymore. It's
Yeah.
the burden or something that.
I mean, that's a powerful statement coming from you.
Yeah.
Doing all right?
Thank you.
You're welcome. It's a good smile. So what I want you to do is Scoot down a little bit towards your feet. That's perfect right there. All right. So we're gonna unwind this a little bit. So his right side has moved forward a lot. You okay?
Just it gives you some emotional release.
Yeah,
though.
no, take your time. We're not gonna move forward. So I encourage you, let it go here. Let it go. It's okay.
Yeah.
This is a part of your body healing.
Yeah. It's just like you don't want to cry, but you feel it.
You have to. You absolutely have to. When something like that wells up in you, it takes more energy to keep it in you than to let it out.
Thank you. Yeah, just the release that emotion. Thank you.
Listen, man, you deserve this. Like I said earlier, like you've been carrying a lot of the family's burden and the stress, you know, and just what most fathers do. It's like, you give me your stress, we'll be good, I'll be strong. But we have to take care of you, right? We have to. You're gonna get through this. I know it's tough. I can't imagine, but you're gonna get through this. And at some point, God's gonna take whatever pain you've gone through and use it for something better.
Yeah, it's hard to show up every day if you feel something in your physical body, not just like your emotional. But yeah.
It's almost like you've been disconnected for a long time.
Just show up though.
Yeah.
It's
half the battle.
Yeah.
Good. Good. People always ask why, why do people start crying? Why do people get emotional? I think it's a combination of all these things. The right timing, the right tone. And I think one of the biggest things as chiropractors, or a person, just as a provider, is being able to empathize with somebody. And sometimes, especially as men, we don't want to because we just don't feel right in a certain condition. But yeah.
So they say, like, if you complain, nobody listens. So sometimes you just don't need to complain.
Well, here, you can complain. I promise you we will always listen. It just makes my heart, this is why I love what we do, is because we can see this type of stuff in real time and be able to have an impact in someone like you, honestly.
Yeah, thank you though.
You're welcome. All right, okay, we're gonna move on. You good?
Yes, sir.
All right. What I want you to do now is you're gonna bend your right leg for me. Just bend it, yep, keep it on the table. Perfect. I'm gonna adjust a little bit more in your mid-back, okay? So I'm gonna take this, let me see this here, just like that. A little bit looser. Right side, actually we're gonna go this way. Good. Easy, you're gonna roll with me. Okay. Yeah. Right under. Okay. I'm gonna loosen the shoulders a little bit first. Yeah, and then we're gonna roll backwards here. We're gonna turn the head. Okay. Good. Breathe with me. I know it's tough. One more. And exhale all the way out. Good. Roll. Relax your shoulders. Easy. That's good. Okay. It's stuck. approach it a little bit from now. You all right?
Yes.
Good. Sit up for me. Let's face that way. 1, 2, 3, up. All right. So that shoulder's dropped a lot. Even this feels a lot better. Look to the right again. Good. Look to the left. Yeah. Look, open your eyes.
Yeah.
Yeah. Look straight. Scoot back a little towards me now. That's it right there. Okay. I'm gonna open the rest of this here. I can feel just so much tension that's happening right here. Yeah, a lot. So when I see this part right there, as soon as I get there, this atlas bone, which is right here, shifted this way. So look, you can look straight. So one of the biggest things that we were seeing on his, along with that occiput we just adjusted, was that his atlas, not by much, but is going off to that right side, 28.36 compared to 28.08. Now the thing is, it doesn't have to be a lot for it to be making an impact, because that's where that brainstem is. So if there's a shift, it's gonna cause some sort of disruption in that area. So we're gonna adjust right there, okay? Okay, all right. Let's see, is it anterior? It is, all right. So you're gonna lean back on my leg, like that. Relax the arms to the side. Perfect. Lean on my leg, trust the leg. Good, easy. Trust me more. Yeah. Good. Too much right there. Good. All right. So we're gonna go right in through here. Nice turn. Good. Easier. Good. Bend your head down a little bit. That's it. Looser. Wow.
Yeah.
Give everybody a minute. That was a lot.
Ooh. Nice.
We're gonna give you. How did that feel?
Just better than good, though. It's kind of open.
Yeah.
I feel like it opened, like. Ooh, nice.
Oh, look at you turning now.
Oh, nice.
Oh, yeah? Let's just look at that again real quick. Look to the right. Yeah. Look to the left. Yeah.
Ooh.
How crazy is that, right? Oh, lift the shoulder up. Do the thing that you were trying to do before. With the push. Remember, like, you're like, oh, I can't do this.
Oh, yeah.
Yeah.
Oh, yeah.
A lot more open now, yeah?
Yeah. Just the stretch.
Just a little, yeah?
Yeah. The sore. Yeah. It's like everybody says, like, it's just like gives you clarity.
Mm-hmm.
Like it opens, like it opens my eyes.
Do you feel more present, more aware right now?
Yes.
Yeah? Good.
Yes.
Did you feel like before you were kind of living in a fog?
Mm-hmm.
Yeah.
Like my senses, like my sensors, like I could my peripheral visions, like I'm more aware, like, yeah, like more I'm awake.
Mm-hmm. Got some energy back, right? Yeah.
Oh yeah. Okay.
Were you nervous coming in?
A little bit. And
A little bit? It's okay. Then it kind of calmed down, huh?
Yeah. Like, as I don't think really my case is not that, not that bad, or it's just like probably the wear and tear. But
I think maybe the body didn't feel as bad, but your emotional case is severe.
yeah,
Okay? So when it's that unbalanced, your body's going to take a lot more stress than you think it will. Right? And that's where I think you probably, it's a different scenario, right?
mm-hmm.
But they have to match. And right now they're not matching.
Yes.
Yep. Now, a little bit better. Good. Let's have you lay on your back now. On your back.
Mm.
All right. Okay. I'm gonna feel the rest of this here. So I'm also feeling a little bit on C3 on this right side, the left side, I'm sorry. Nothing too crazy, just a tad. But we can feel a little bit of this restriction as soon as I get to this point. You feel that? Yeah. So nice and loose. Nice and easy. There we go. Yeah. Good. Good. One more here. Okay. It's better. And then a nice little one. Good. Yeah. Good. Nothing crazy. Just a little bit. Better. All right. Now, what I want you to do is you're going to sit up for me here. 1, 2, 3, up. Keep the legs all the way down that way now. All right. How do you feel? You look like you're sitting up a little bit better, huh?
Yeah.
Yeah.
I feel like I'm balanced, and my feet are like touching.
Eat more evenly?
Balance. Yeah.
Yeah.
Like, earlier it's like this is like feel like this is shorter.
Mm-hmm. And it's crazy that it was all just from up here, right?
Yeah.
Okay. So right there, I don't like that. So it turns in. So we're gonna go the opposite way. Here. Nice and loose. Just like this. Let me see this arm here. Actually, let me take this other one above and put this one underneath. Good. Like that. And relax your shoulders. There. A little bit more. Head down. Alright. Good. Bend from here. Just lean back. You're good. Relax your shoulders up. Let it go. Easy, yeah. Just keep it curled. 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 Yeah, there you go. Curled. Easier. Let it go, let it go, let it go. I got you. Yeah. There it is.
Yeah. Yeah.
Yeah?
Feel taller. Yeah. There's something that, yeah. Oh.
We just unwound you. So a little bit, so his hips were turned in this way. So what we want to do is kind of turn him out that way to keep the spine a little bit straighter, more neutral. It seemed like it worked a lot better that way, yeah?
Yeah.
Good. All right, let's keep going, yeah?
Yes.
Okay, let's have you, I want you to lay on your side and you're gonna face towards me this way. Yeah. Okay. Scoot down a little towards your feet like that. That's good. Stay there. keep this. I got that. Here we go. All right. Just like this. All right. Let's go over here. Breathe, okay? Nice and loose. So we like to make sure that whenever we're adjusting somebody, you're gonna roll with me, your whole body with me. It's better. That whenever we are adjusting somebody, that their spine is at ease. So when I roll, you feel like it's good, right? Actually, I'm gonna pull this. That's a little bit better. That's good. And we don't want a lot of tension. And so a lot of times when people say, oh, they couldn't adjust my back, it's because they try to rush it. A little easier. A little bit easier. Oh, breathe. You're not gonna fall. I got you, look. Okay? Here. There it is. Oh.
Oh.
Yeah.
Oh yeah.
How's that feeling?
That's ooh. A lot. Oh,
There's a lot. Yeah, your body's just kind of taking it in.
wow.
So I know you've been to the joint, you said, right? A few times. How did you do afterwards? Difference-wise, all that kind of stuff?
Like nothing really. Just like
Quick.
in that right there and there, and then once you step out, I mean, you can't feel the difference from coming in, getting out.
Yeah.
Maybe initially the first session, like you would feel a little bit relieved, but
Yeah.
And I don't think it would like. It's so generic.
Yeah. We call it unhonoring.
Nice. Oh,
How you doing now?
feel much alive.
Yeah.
Really. Ooh. Oh, that's one stuff,
That was a tough one, yeah, for
Yeah.
sure.
but it feels good. I mean, feels me alive. I mean, like the lights are brighter.
That's what I always say. Lights are brighter, colors look brighter, everything
Yeah.
kind of looks brighter.
All right. Thank you, Doc.
You're so welcome.
Didn't expect this. I mean, I feel like I just want this experience because I've been watching you for a long time until you kind of move here, and it was just started with before it happened to me. But yeah, I didn't really know about that the body would react, as like fight or flight.
You look a lot more relaxed right now. Like your demeanor is like you're finally taking some deep breaths.
Yeah, it's
Yeah.
like this is what they mean. Yeah. Thank you, Doc.
You're welcome. Let's have you lay on this side now. Good. All right. Keep this straight. Bend this knee here for me. You're doing good. Yeah?
Yeah.
So I know you came here for the experience, right? But you deserve an experience like this every single time. And we'll do this every single time with you. All right?
Yes.
Unwinding. I call everybody onions. We all have layers that we got to peel back. You're not an exception.
True.
Lots of layers. Okay. Here we go. You look crunched up. All right. I want to see. That's better. Yeah, there we go. Okay. Nice and loose. Good. You're gonna roll with me this way. Entire body. Just go on your shoulder more. Okay. Scoot back with the shoulder a little bit. That's it. There you go. That's better. Good. Easy. Roll with me down. Good. More. That's good. Okay. Good. All right. All right. We're gonna lay you straight again, okay? That's good.
Yeah. Good.
And then scoot up a little bit more towards me this way, like that. All right. Let your head come up and down. Awesome. Good. Nice and easy. Good. Deep breath in through your nose. Out through your nose. Good, easier. Yep.
Oh.
Oh man.
Yeah.
That's the release. That's it.
Yeah.
There's a lot that I need to release. Oh man. Oh. It's like one peak to another.
Mm-hmm.
Oh. Thank you, Doc.
You're so welcome, man. You deserve this.
Thank you.
Yeah.
Oh yeah.
Good.
Good.
You want to sit up? 1, 2, 3.
Good. Thank you.
Good. Turn and face the wall that way. And let's try this again. Let's have you, wow, look at that. The way you're standing and the way you're just sitting, so much better. Look to the right again. Beautiful. Left. Beautiful, yeah? Look, any pain when you do that?
No.
Can go to the side. Let's have you look all the way up to the ceiling. Yeah, how does that feel this time?
Smooth.
And down. Yeah, stand up for me too. And move forward and try and touch your toes. There we go. How does that feel this time?
Yeah.
Yeah.
No restriction. Like kind of. Yeah.
Like you can actually go down, right?
Yeah.
So good, man.
Thank you. Didn't expect this, Doc. Until I really feel it.
Yeah.
I kind
What did you expect?
of feel like, just like,
little bit, yeah.
adjust me. Didn't feel like gonna release this, this feeling, this emotion. This like kind of restrict you.
Yeah.
Kind of restrict you, but now I could like. It's hard to explain, but you can like. Even if I sit, I feel like I'm straight, and then I don't have this stress, don't have this emotion, something that kind of weighs me down to, kind of releasing like started with the neck and the side, and then
The pull.
when you pull, kind of release that. Thank you.
You're welcome.
Thank you. It's good. More than good.
It's my pleasure to be able to help you and to serve you and just to give you some relief, man. You've been through a lot. but you know what? You got a home here. You can come back. You can get adjusted. You can always feel like how you're feeling right now is how I want you to feel all the time.
Yeah. Thank
All
you.
right. Yes.
Thank you.
Good. Good seeing you, man.
Thank you.
I appreciate you.
Please. Okay.
All right.
Thank you. You're good.
Yeah. Thank you. Have a seat. Let me. I'll go. I think. Yeah. Have a seat. We're gonna go over everything here. I'm gonna take this out. Feeling okay?
Yeah. Feels brand new. Yeah. Feel brand new.
At the end of each day, I want you to take about 5-10 minutes to yourself. No phones, nothing. Just breathe. Okay. Deep breath in for 5 seconds. Hold it for 5 seconds. Exhale out.
Okay.
You keep doing that. It'll switch you into the parasympathetic system. Okay. And allow your body to relax more.
Okay.
All right.
Yes. That's
Yeah. Good. We're gonna go over the pricing and everything now.
Yes.